Megan, thank you so much for your time. Let's pick up where we left off. So essentially, while the rates of HIV in children has declined significantly since the early 2000s, we've seen this is still a critical issue in South Africa with the estimated 270,000 of children aged 0 to 14 years still living with HIV. Just talk to us firstly about your observations, especially as it speaks to access of very important treatment for children.
Yeah, absolutely. So definitely South Africa has made significant strides in dealing with HIV and especially our treatment program. I think our biggest challenge, though, for children is that we are not seeing the same uptake of treatment for HIV as we're seeing in adults. At the moment, for those who are positive, we see adults at 79% being on treatment, whereas for children, we're only looking at 50% of children accessing and maintaining HIV or antiretroviral treatment. And that's our biggest challenge at the moment.
And why do you think that is? I mean, if one considers that over 2,000 children die from HIV and AIDS-related illnesses, surely the priority should be equal across the board.
Absolutely. I think the biggest challenge, we have to look at social barriers. So within the family, we have poverty, which is a great challenge, where children are unable to access the right nutrition, and then taking the treatment becomes exceptionally difficult for that child. And it's hard then to maintain the child on treatment. That is one area. We continue to experience significant stigma at community level. So where parents feel unable to acknowledge that their child has HIV because it's an acknowledgement of their HIV status as well, and then they do not follow up and take children for treatment. The other challenge is that children very often don't seem ill, so they're not overtly sick. And because of that, parents then don't realize that the need for treatment as early as possible in order for the child to maintain their health.
And one would assume that even though, the parents, let's say the mother, of course, who has to breastfeed the child, does or is living with HIV, surely with them taking the necessary treatment, they could then prevent, infecting their baby, because new infections also are hovering at very high numbers. How do parents even begin then to do that, protecting their children?
Yeah, I think it's a big challenge, especially with newborns. First of all, children need to come back after their first HIV tests. Babies, within 18 months, we must retest so that we can confirm the status of the child. But very often, that is when the parents don't bring the child back, so that they don't then realize the need for that child to be on treatment. So it's very important for early infant diagnosis. The sooner you can detect HIV in children and the faster we can get them onto treatment, their prognosis is really good. It's very positive. And we have many people living very long and healthy lives if they're starting treatment at the right time.
Yeah, especially if you consider that roughly 2 million people who are living with HIV or who are HIV positive are not on treatment, even, despite the fact that it is accessible. But I want to just get your reaction then to what Deputy President Paul Mashatile said earlier in his capacity as the South African National AIDS Council chairperson. He says that, the demands that were made and submitted by the Treatment Action Campaign to provide 6 months worth of antiretrovirals to patients are reasonable. So I would imagine the implementation thereof will happen and will benefit the health department instead of what we are currently experiencing in as far as 3 months intervals we are seeing now. Just your response to that?
Absolutely. If people can access treatment and only return to the clinic twice a year, we do have a much better chance of people remaining. I think the only challenge for children is that there's a lot of emotional support needed, so a lot of counseling, especially as young people transition into adolescence. And we need to set a system where families can feel that they can come for the psychosocial support needed for HIV treatment and not just the physical treatment. So the medication, absolutely, making sure that people don't have to come to the clinic, don't have to miss work. Those are really, really important. But in the same breath, we have to emphasize the value and the need for psychosocial support, for counseling, to help particularly young people transition into adulthood with HIV.
Just on the aspect of nutrition, especially for children, we know, of course, children living with HIV should be well taken care of, not only from an emotional perspective, but also just from a dietary perspective. We are running a story, a very devastating one, of, still so much stigma that surrounds children who are living with HIV in Limpopo, for one, and just the appalling conditions in which they live in. Just talk to me about what you are observing in as far as that is concerned, and how that is further then affecting those children that are living with HIV.
Yeah, absolutely. I think that's one of the greatest barriers for most children, is if they're not receiving the right nutrition, not just to support them when they take their medication. So you can't really take it on empty stomachs, and children do not feel well, and then they're resistant, but also just for their overall general health. But I think our biggest challenge, or maybe our solution, is a real multidisciplinary approach. So really strengthening our feeding programs within our early childhood development centers, as well as our schools, and ensuring that all children get the nutrition they need. And in that way, we will capture our most vulnerable, our HIV positive children.
Megan, thank you so much for your time and, of course, your insights. Megan Briede from Save Our Children South Africa. She's the program director there for us, of course, just speaking around World AIDS Day, which is being marked across the world today.